Awesome. Thanks everybody for joining. My name is Adam Halpern for the new people that have joined the call. And I am the founder and CEO of a company called Innovate AT, which is really innovating the athletic training profession. But at the same time, we have a new service, which we call WaveOn, which is focused on redefining the healthcare experience for millions of amateur and recreational athletes. So the reason this idea is so powerful for today's amateur and recreational athlete, we have a panel of athletic trainers that have worked in a variety of settings, ranging from high school, high-level collegiate athletics, professional sports. And we've passionately realized that athletes in those organized settings get this level of healthcare that's all around access. These athletes have unlimited accessibility to us. We help them with our skills and our tools and our resources. And then we also have the next level healthcare provider within our cell phone to streamline the healthcare system, improve patient outcomes, and decrease the overall cost of healthcare for those athletes that are in organized sports. However, all of us are still in local communities. We work with club athletes, we work with recreational athletes, and their experience to feel better and to get better is completely different. They enter the healthcare system and it takes a lot of steps. It costs a lot of money to get the outcomes, to improve performance, to get back on the field. So what WaveOn really does is we're taking this high level of expertise and knowledge, and we're bringing it to the public to really streamline the healthcare system, improve outcomes, and give you an experience that you can't get anywhere else. So for Matt, Dustin, Beth, and all the other listeners that aren't athletic trainers, that are coaches and parents and athletes themselves, we appreciate you joining. We're excited to have a discussion around home injury management during the coronavirus, because as athletic trainers, we all realize that while sports have stopped and team sports have stopped, athletes have not stopped working out. If it's doing burpees in the garage, doing wind sprints in the driveway, doing drills in the backyard, musculoskeletal injuries are still going to occur. And more importantly, a lot of athletes are sitting around all day, watching Netflix, watching Hulu, doing school on Zoom calls just like this. And then when they go out and start to perform activities, that's when their body is unprepared for those stress levels. So we're going to talk about how to manage the injury at home, how to prepare for what's going to come next when sports get back into existence in our daily lives. So on the call, like I worked at Stanford in the US ski team. We have people that worked at high-level collegiate athletics, including Wisconsin and Denver University. We have Major League Baseball represented on the call, high-level gymnastics, national rugby. So I'm going to let each athletic trainer introduce themselves. We're going to talk about their perspective on what athletes need to be doing at home, how we can empower you as a coach or as a parent for your young athletes. And then at the end, if we have some time, you guys can ask some generic questions. We're not going to dive into the details of a specific injury. We're going to start doing these frequently, so we might have more specific topics as we move forward. But this is more of just a high level to understand how and what athletes can be doing at home to continue to play the sport that they love without having an injury setting them back. So I'm going to kind of manage it. I'm going to facilitate it. I'm going to go down the Brady Bunch list. So I'm going to let Wes Richardson, who's in Alabama, give a quick intro about his background and why he's passionate about being part of the program WaveOn.
Good morning. Yes, I've been a certified and licensed athletic trainer for over 26 years now, primarily working with high school athletes as an outreach athletic trainer for different employers. And I love doing that. I love taking care of the athletes and helping them to be successful. But I've also worked some on the collegiate level. I've got a national championship from the University of Alabama in 1992 and 2 national championship rings from University of North Alabama. And I've been fortunate enough also to work with state championship baseball teams and some runner-up championship teams in football and basketball. So a lot of fun experience, and just glad to be a part of this call.
Awesome. Thanks, Wes. Nora?
Good morning, everyone. My name is Nora. I'm a licensed athletic trainer in Denver. My former positions include the Mayo Clinic, the University of Denver, where I worked with swimming and volleyball, the University of Wisconsin-Madison, where I worked with swimming and men's basketball in the private setting, and now obviously an affiliate athletic trainer with WaveOn. I came to WaveOn because I believe it's the future and next generation sports medicine for athletes, and I want to be a part of that, and I want my community to be a part of that. So that's why I'm here.
Awesome. Thanks, Nora. Tyler?
Hey guys, yeah, my name is Tyler Triggs. I'm a licensed athletic trainer as well in the Kansas City, Missouri area. My background ranges from Division I baseball, Division II baseball to things like high school athletics. I have a lot of experience there. And then also a small business owner in the area, providing sports medicine services. And the reason I joined WaveOn was it matched my vision with my business restorative movement to just allow anyone who wants to take control of their healthcare to do so with access we've not seen before. So excited to be here.
And I'll kind of notice some of the chat messages as we go through. Beth is excited because she says, "Go Chiefs, go Royals." Sarah?
Okay, good morning, everybody. I'm Sarah, and I'm from Utah, and I've been fortunate enough to work at a Division I university here for a couple of years, and got to work with track and cross country, a little bit with women's gymnastics and women's tennis, and really enjoyed my time there at the collegiate setting. And then the last 2 years, I started like my own personal business to provide sports medicine to athletes that are not like in sports that typically have access to an athletic trainer. I've been a gymnast for a long time, and I've been coaching gymnastics for the last 14 years, and I love it. And so that's kind of like my main passion of trying to bring better care and better access to gymnasts and dancers and cheerleaders that I feel like typically, because they're not like high school sports throughout the nation, that they don't even meet an athletic trainer until they make it to the college setting, and that's if they remain healthy enough to make it there. So that's been one of my big things. And kind of when I heard about WaveOn and met these amazing athletic trainers that have this similar vision as me, I really fell in love with that, of trying to provide care to every individual and providing like that access, and how much that opens up the individual's resources, whether that's their time and their money, and as well as their health. And so that's been a big passion for me, and that's why I'm here.
Awesome. Thanks, Sarah. Catherine?
Hi, everybody. Excited to have you all here. I am a licensed athletic trainer based in Massachusetts, just outside of Boston. My experience is extensively in rugby. I am one of the athletic trainers for the women's national team, and I work with the New England Free Jacks of Major League Rugby. In addition to that, I've had experience extensively in college and high school, and all of the kind of different clubs and things in our area here in Boston. I jumped in head first into WaveOn because I just felt like it bought into what I believe in, and kind of taking sports medicine to that next level and making it more accessible to everybody, and not just the collegiate and professional ranks.
Awesome. Thanks, Catherine. Josie?
Hi, I'm Josie Harding. I'm currently stationed in Arizona. I have a lot of history with youth athletics in the academies, clubs, as well as the high schools. And then I'm also very fortunate that I've been involved in MLB, primarily with the Brewers the last 3.5 years. I'm also a former business owner as well that placed athletic trainers on the sideline to improve healthcare system, right? Direct access to them. I hopped on WaveOn because being at the professional level, I realized the accessibility to healthcare that these guys consistently had, and the availability they had to me, the doctors, the strength coaches, and I realized we should be doing that at the youth athletic level when there's more athletes at that level getting injured, that parents more unanswered questions for them. So to me, this was an opportunity to jump in and give that access of what the professional and college give to the youth athletes that will have no idea that this exists unless they get that far in life.
Awesome. Thanks. Jodi?
Sorry, guys. This is Jodi. I'm from Birmingham, Alabama. And the reason I got on WaveOn is very simple. It's the fact that working in the college and professional level, it's very simple that these athletes had access to care that nobody else does. And then I worked in the high school setting for the last 15 years, and it's been amazing how many people don't know what to do next. And so many people spend so much money doing things that they don't need to go. They sprain their ankle and think they need to go to the ER. And working at the college and professional level, it was very important to me that, hey, there's no sense in us spending this much money doing these things that we don't need to do, when all you need to do is call me and we can take care of this. And there's a simple fix 99% of the time. They are those cases that need to go to the doctor, but a lot of these things are overuse injuries that we can fix at home. We can give you exercises. We can show you what to do, just like we do at the college and professional level. Most of these guys don't go to the doctor most of the time unless they have a serious injury. Most of these things we fix in-house. And this is why I joined WaveOn, was to be a part of that, to help people get the health care they need, give them direct access to great doctors, and be a part of something special to make their children, youth sports athletes, do very well in life. It's very simple. We want to be a part of making your life easier.
Awesome. Thanks, Jodi. And then Misha, if you're available, love to hear from you as well.
Yeah, my name's Misha. I was in Division I athletics for about 12 years. I worked at Princeton, Temple, and Villanova with various sports. And I, about 5 years ago, made the transition more into the strength and conditioning world because I saw there was a huge gap between athletic training services at the college level and what the strength coaches can do, and there needed to be someone to fill that gap. And opened a business back in Philadelphia. And the reason I joined up with WaveOn, I'm currently in Arizona right now. I'm a licensed athletic trainer out here. I still own a gym. I'm still practicing athletic training. But even in, like Josie mentioned, even in the youth sports that are the, you know, the club sport levels, and I'm even finding in my general population, you know, nobody does know what to do when they get injured and they have issues going to, or they have trouble scheduling with their doctors, or they end up in the emergency room waiting forever, and they end up in a boot for, you know, no one's there to actually help them manage their injuries. And if you look at the services that, you know, collegiate athletes and professional athletes get, why don't people, like normal people, have access to this type of injury management? Not necessarily even just the rehabilitation, but, you know, figuring out if something does need to be seen or who to go see, so that you're not going to see 15 different doctors and, you know, then a year later you're still dealing with an ankle sprain. So, yeah.
No, that's perfect. One thing that I want to highlight to the non-athletic trainers, because athletic trainers get this question all the time, like, what's the difference between an athletic trainer and a personal trainer? And sometimes they ask, what's the difference between athletic training and physical therapy? This ties into this home management of an injury that your athletes might receive. But for you guys on the call, if there's a little bit of clarity that we can bring, and or the listeners, I want the athletic trainers that feel comfortable really discussing what a licensed athletic trainer is and why that's important when we talk about healthcare, because personal training is just a certification. It's kind of an unregulated profession because there's not state licensure. But then what licensure means for athletic training on the medical side. So if anybody feels comfortable discussing that, we'd love to hear your opinions. Not all of you at once. Wes
I'll go to start. Yeah, as far as athletic trainers, we are trained specifically to evaluate and assess and take care of athletic injuries. That's the easiest way to say it. Oftentimes we are seen as the intermediary or the liaison between the coaches and the parents and the physicians. So we specialize in preventing those athletic injuries and taking care of them when they do occur. You know, personal fitness trainers, those guys and ladies do a great job. Of course, we're all just a little bit different, though. They specialize in, you know, taking care of active individuals and helping them to, you know, develop good physical fitness. A little bit of what we do as well. But as athletic trainers, you know, we are required to do continued education each year, as well as get at least a bachelor's degree, which is actually going now to a master's degree. So a lot of us have that extra education and training, and you know, we specialize in sports medicine type injuries.
No, that's perfect. Any of the other athletic trainers have any other thoughts, or did Wes hit them all? And you can just shake your head, yes or no. Oh, Tyler has something.
Yeah, Adam, I think one thing unique about athletic trainers, because I know a lot of times people ask the difference between us and physical therapists and other people within our field, is that we have the unique ability to see injuries from the day they happen all the way to the day they return. And that's not many people get the chance to do that. We work with the athletes on the sideline right when they occur, so we understand what's happening and why it's happening. And then we get the unique ability to work with them the whole way with the different medical teams. And we also are the ones that get to kind of help them go back onto the field. So we have a good understanding of the whole gamut of injuries and that whole process. So that's a nice way that we can bring this into WaveOn and help people on all different levels and all the different timelines.
No, and that's perfect. And yesterday we were talking as a group, and Josie had some statistics around youth injuries. And obviously we're mostly talking about youth sports because of the listeners on the call today. So Josie, give some of those statistics you had around how many injuries occur year to year.
Yeah, so recently there was a study put out. It's actually been published in multiple journals. The one journal I found, it was in the Journal of Athletic Training, that there's 3.5 million athletes from the ages of 14 and under injured a year. And how they account for these injuries is through them visiting the ER system. And so with that being said, we know that there's going to be an increase of injuries coming this following year because of the movement is going to be less, preparation is going to be less. And so obviously this is kind of brings in and ties into what we're doing today in the home management injury care. And we talked yesterday, and Nora had some good points with it, was the statistics is only going to raise if we don't take care of our athletes now. And those of you guys on the call, we can realize that injury is always a concern and financial burden for any parent. And so we always have that concern of what's going to happen next. What do we do with our kid? How do we prevent that? How do we not become a statistics? And so we also know too that out of these youth athletics, about 3.5 million of these, over 60% of those are overuse injuries that can be managed and prevented. And I think Wes mentioned that earlier about how, or Jodi said that a lot of what we manage, 99% of the time, it can be, home injury management or what we do as athletic trainers. And so that kind of brings in the points that Nora had yesterday with us.
No, that's perfect. Nora, dive in a little bit into what those statistics were and that information you want to share.
Yeah, I think we are facing some times that we are not prepared for or know how to prepare for. This is very unique, at least in my lifetime and most of our lifetime. So I was thinking through of some of the changes that our athletes are enduring right now is pretty obvious. So while we, no matter our age, we are bound to our computers right now for school and for work. And you wouldn't believe how fast your body will decondition or lose part of your aerobic fitness. So a lot of times when I'm working with youth athletes, I'm like, have you ever been sick for a few days and just laid around? Then try to go back to school? Did you feel really weak? And they're like, yes, I felt like my muscles have really atrophied and I felt really weak walking around school. And that's because you wouldn't believe how long it doesn't take to lose those fitness levels. So take, for instance, if you're a student athlete that formerly spent your days at a large high school with 5 to 6 floors. I know in the Denver area, these schools are huge. And but now all you do is sit at your computer for school. You're not getting those steps and those stair climbs. So you lose that leg strength, the core strength, and your aerobic capacity. So these are daily demands that you've placed on your body every day and now have gone a couple of weeks without those demands. And I'm afraid that our athletes won't likely notice these changes until they go back to their sport. This deconditioning could likely cause an injury. It is hard on your body to go from 0 to 60. And with that being said, I want to introduce you to a term called cross-training, which is a physical activity that is not similar to your main sport. And cross-training is a great tool to sub in for those missed activity levels, such as walking around school all day and going up flights of stairs. So for instance, if you're a baseball or softball player, when the weather allows, which in Denver, it's really turning around, it looks really awesome for the next 10 days. Some light aerobic biking for 30 minutes to an hour can substitute what used to be walking around school. Cross training is performed not in replacement of what you do for your main sport, but in addition, especially if you're trying to keep up your fitness levels. But sometimes if you're injured, it is in replacement of your main sport. So this simple incorporation can help prevent some acute overuse injuries when you go back. And I know usually at my job, I'm up on my feet all day for 8-9 hours. So what I've been doing is getting out on my road bike for a couple hours each day when I can, because I'm an athlete too. So those are a few tips and that I want to point out.
No, those are great. And I'll open it up to Nora because she is finishing her thought, but other athletic trainers on the panel, if you have additional feedback. Because we have coaches on the phone and we're trying to empower coaches, what are some suggestions as to how they can communicate what we're talking about to their athletes so when they go back to sports, they're decreasing the rate of injury? There's still going to be injuries, but how can we empower the coaches on the phone today with what you just mentioned? Nora, what are some suggestions?
Yeah, I think if you're just pushing out content to your athletes is just simply point it out. Maybe they don't even realize how much they were active around school and then in the afternoon at their sport, and making sure that in between their online classes they can get out and do something different. And I don't think it has to be very specific and scientific. It's just get up and move around, and I think just the awareness is at a minimum what we can do.
Anyone else have any suggestions? Catherine?
Yeah, I would like to add too.
Oh, sorry.
Catherine, then.
Yeah, Catherine, go first then, sir.
One of the other things you can do I know a lot of coaches are sending out different content and whether it's plays or other skills or practice plans, empowering your athletes to take advantage of whatever opportunity they have, whether it's you finish one assignment and you get up and you go for a walk around the block, or some other types of videos of exercises and different things that they can be doing, or just kind of around with whatever small space or things that they have around their house, since we're all stuck in our homes.
Perfect. Sarah?
Yeah, I think another thing, like from being a coach myself and just knowing that I think the big struggle for a lot of our athletes is just motivation during this time. It's like they've lost all the structure of their regular lives and don't have people that are routinely necessarily like checking up on them or helping them, or the avenues and outlets that they usually had. And so I think another big thing besides pushing, like sharing the information and kind of trying to create the awareness, is even just posing a simple question to your athletes of, I know that you had goals like before this all happened, like goals in your sport, goals for your fitness, these goals. And then just ask them the question, have you done anything this week to work on those goals? Have you done anything over the last month to help you achieve those goals? So I think trying to help put that in their hands is a good motivation of just like creating their awareness of like, if these things are still important to me, I need to think about something and do something to help myself still reach those goals, and helping those goals still be in front of those athletes, I think is a big thing.
And I think that's where, oh, sorry. Is that okay?
I was going to say, yeah, I was going to say.
I think that's where the coaches are like the advocates on this call, besides, the sports medicine staff, is you guys can be that encouragement to these athletes. Right now, like Sarah mentioned, everyone is thrown off right now. The routine is off. Parents are off. It's such an uncertainty time for people. So fear and anxiety has risen in everyone. And we know that fear and anxiety lead to bad habits, unable to heal properly. All these other things come with this. But if you guys can be the ones to encourage, to push, to help these athletes or parents, like give them the little things of like, instead of picking up your tennis racket, why don't you guys do an obstacle course with your soccer ball in the backyard? And being that encouragement to these athletes, like parents and coaches, you guys are the first line of defense to these youth athletes.
To the point of all of you, I think another component, because of the stress, because of the fear, it is an opportunity for everybody to have fun with sports again. And it doesn't have to be about winning and losing. And even though we don't have access to our teammates and we don't have access to even playgrounds in the park, give the listeners some suggestions on how you can take a sport specific exercise and just make it fun. I mean, you guys are gonna have to get creative on the spot. Does anyone have any suggestions around the fun side of it?
Yeah, can I jump in on the last point? I think like what I'm seeing a lot with the athletes that we work with is, since there's a lot of free time, they're trying to add more. And you have to remember that a lot of these athletes are already going 24/7 right now. You know, sports are all year round in most colleges, and in most high schools, you're playing the same sport all year round. So I think while the cross-training component is important, it's also important to recognize that you don't have to add more to your day as well. Getting good quality sleep, improving nutrition, figuring out how to reduce stress levels are all also really important factors as well. So not pressuring them to do more in a day, because they're all going through the same levels of stress, and your body reacts to stress. Whether it's stress from sport or stress from a pandemic, it's going to react the same way. So being careful about how much you're trying to add to them. But I definitely see benefits. Like a lot of the clients that I work with, we have incorporated play into their programming. So I have someone who she's actually a CrossFit athlete, but she has rediscovered biking and hiking and just getting outside and doing things. I mean, we're in Arizona, so we have the freedom to be able to do that. But finding things that they like to do, we have people that have picked up sports that they haven't played in a while, you know, finding other things that they like to do. And the athletes will tell you what they want to do. It's what, you know, your body will tell you what it wants to do. So allowing for that creativity and allowing for someone to also say, you know, I need to do this to take care of myself. Sleeping, nutrition, all of those things are equally as important.
No, that's perfect, Misha. That ties into my fun question about just playing and doing new sports that they haven't been doing. Do you guys have any other thoughts around that? Any of the panel?
Adam, kind of like you're saying, I think just everyone else was just saying, just having them do things that, I know sports are so competitive now compared to what they used to be. And maybe you have a kid who does dance 6 months of the year but really enjoys basketball. This is a time where they can move their body in a different way to avoid some of the overuse injuries but still move. Like I have a volleyball player right now. She used to play basketball years ago, but now she just gets to go outside and shoot hoops. It's a way to stay active, keep her moving, and avoid some of that stress she usually gets from volleyball. So things like that.
That's perfect.
Yeah.
Anyone else have any thoughts? If no one does, I'm going to go back to what Misha was talking about, the sleep component. I briefly saw this. I didn't dive into it, but there was a study, a self-study by a couple teachers at a university, and they asked their students about their sleep patterns. And I briefly saw it, so the statistics are very vague and rough, but it was upwards between 35 and 50% of their students are now going to bed after midnight and after 2 a.m. And then they're sleeping way later in the day. So everyone's rhythm is totally off. So we have to take that into consideration, which will help prevent injuries, which will help healing, like Josie was talking about earlier. So if any of you on the panel, because you are still working with athletes, have you had any discussions around sleep and have seen behavior changes? Josie, you're shaking your head, so I'll let you.
Yeah, so I've actually, a good handful of my baseball guys, they're lost. It's crazy how when your sport stops, they are completely confused with life. And so right now they should be in the midst of games, you know, they're supposed to be in season right now. And so these guys have picked up video gaming, or they've been sleeping till noon, and then they're like, man, I just feel like crap all day. I don't get why I'm so stiff. Throwing's harder than it was a month ago, and I was throwing a lot more. And so I kept having the discussion with them on like, okay, what does your day-to-day look like? So I actually had my athletes start journaling, like what their habits were, what they were doing, how things were going, how they were feeling when they were doing it, so they became aware. Now this may be hard for a 14-year-old, a 12-year-old to do. This is more of a professional level, like athlete was doing this. But I also have a couple of my high school athletes who are doing it. And then we sat down, we're like, okay, so what is your issue? And they're like, I'm not sleeping, I'm not going to bed till 2:30. And then I'm getting up at 10 o'clock or noon because I have to do my class. And so we had that discussion with them. And so it's just making them aware of the situation. I do have a couple of my other athletes that I've been talking with parents about, or this beach volleyball club where he's like, how do we make sure my athletes stay excited but motivated and still maintain sleep? So he's been talking to them about habits of sleep, make sure they're not napping throughout the day, getting outside when they feel like they have to lay down in the middle of the day. So a lot of those discussions that we've been having, especially with my athletes, I have been.
That's great.
So, Adam, this is Dustin from Colorado. If you don't mind if I say something real quick.
No, this is perfect. I was going to open it up to questions from you guys, so feel free.
So, Nora actually brought me in. A couple of my girls already see her. I'm finding this information very helpful. Just to kind of jump on what Sarah said, I'm a coach for Prodigy Fast Pitch girls softball. So what I do for my girls on their downtime right now, I do exactly that. I have them do a journal, probably every 2 weeks or so. They'll do something different. I just want to keep their mind going and keep their IQs going. But the biggest thing about this pandemic that's going on, I want to know, their feelings, how they're doing. So I do the journal, and that does work out. It gets the girls to actually open up quite a bit more than what they would do for their own parents. So I find that very helpful for these girls and the athletes.
And as a coach, has that information that you have learned from their journaling helped set your strategy with the girls, the programming, the objectives?
It has been, yes. It kind of gets me more involved and lets me know exactly where the girls' minds are at and, exactly how they're feeling. So, you don't push that one particular girl, or you pay a little more attention to her feelings and actually what's going on.
No, that's great. Kudos to you. Hopefully the other listeners are able to learn from each other as well. I mean, we have a panel of athletic training experts, but you guys are the coaching experts. So hopefully that's valuable for you guys. Awesome.
Can
Josie,
I ask a question to Dustin?
Yeah.
So being the coach right now and overseeing such a big organization, besides obviously not coming together as a team, because we know that the psychosocial development of these kids, coming together is really big for them. What are you finding the most struggle, what your parents and athletes are needing now?
Getting together. These girls, I can't speak for our president. I'm hoping that he was on so he could listen. But I've been coaching with him for over 6 years. And, what I'm finding, I'm bringing the Zoom meetings in for keeping all of our girls. I got a very tight-knit, close club team that have been together since they were 8 years old. And now we're a first-year 16U team. And the girls just really want to get back together. It's very hard for them right now. Just like the baseball players, their whole world is kind of confused right now. Not being able to play the sport they love and actually getting out and getting together. So we've done a lot of Zoom meetings. I do it once a week. I do the journal to keep them going as well, just to kind of keep them, just their minds going for them.
That's great. Fantastic. I'm gonna go to the chat board. Matt asked a question regarding wellness questionnaires and if we think those are beneficial for the coaches to deliver to their athletes. So panel, what do you think about wellness questionnaires?
I use them daily. I find it for my athletes, I find it really helpful. So I have about 50 national team pool athletes that are around the country. So even when we are not stuck in a pandemic, I can't see them daily. So they fill out questionnaires, and they're 0 to 5 or 1 to 5, quick. How'd you sleep? What's your level of soreness? And then there's a spot for them to fill in any new injuries. I think it's a great, simple way to kind of just check in. And I think for the high school level athletes and the club level athletes, you don't necessarily have to be doing it twice a day like we're doing it with the national team. But just a quick check in. How's everybody feeling? We found that people are a little more honest when they're on this scale instead of right in front of them and directly confronting them. Then you can take that information and check back. If you've noticed somebody's been sleeping 8 hours, 8 hours, and 8 hours, and then all of a sudden they have 2 to 4-hour days, you can be like, it's a little red flag for you and say, hey, what's going on? You know, or their soreness level changes big time. Hey, what's going on? And you can kind of touch base and look at that and keep track of that historical data too.
Anyone else have feedback?
I think a lot of our sports medicine, coaching, strength training is going towards what's called like patient-centered or more athlete-centered. I know when I was leaving Wisconsin, we really started integrating GPS tracking and the catapult technology, and then also subsequent questionnaires, because each athlete is different. And I think the old way was kind of putting them all in the same fabric and prescribing them the same regimen. And where a lot of where we're advancing to, especially I know what we're doing with WaveOn, is getting more athlete-centered. So I think wellness questionnaires really dive into the specifics of that athlete and how they respond differently. And I really think it will be transformative to go to more quality instead of quantity. So I know when I was growing up, it was how much can we run, how much can we practice, and then now that's starting obviously catching up with us with the injury rates and the competitiveness. So we have to go to more quality, or we don't have any other choice. So I think the wellness questionnaires are a really great and easy first step towards that.
No, that's perfect. The only other thing I'll add, just like anything at the simplest level, if you do a questionnaire, you as a coach are adding something on your plate to do, and you're adding the athletes a task to do. So if you do it, just use the information. Don't just do it because you think it sounds good or it's something that someone else said. Really value the information and the data that you're collecting, which then sets the strategy like Dustin recommended. So that means probably have a very simple wellness questionnaire. To Catherine's point, like 5 questions. It doesn't need to be a 3-page document that then when you receive as a coach or an athlete, it feels daunting and overwhelming. So we really want to have clean data that allows you guys to set the standards for moving forward. Any other questions from the group that aren't athletic trainers? Does anyone have any? And I'm looking at the sheet or the chat board if anyone has any. Athletic trainers, do you guys have any last minute thoughts that you want to share with the group?
I had a last minute thought.
Yeah, go for it.
I think just what I've really appreciated about this call and like having coaches and athletic trainers on the phone together is I feel like we have the same end goal, which is to have like a personal relationship with our athletes, to know them, to know what they need, and to be able to help like provide that and empower them to take care of themselves in all aspects, like their wellness, and then also to, you know, just get like the most out of enjoying sport and enjoying physical fitness and life. And so I just really enjoyed being able to like hear some of the feedback of the coaches and the different ideas of like, you know, that we've talked about wellness questionnaires, and we've talked about like sleep and nutrition and just like these things that affect like performance and affect individuals. And I think it's just cool that like we really are on the same page of how much we want to care for these athletes. I think that's really great.
No, that's great, Sarah. Thanks for that just personal statement. I'm looking at the board, and Beth also wants us to remember that parents are part of that same team, right? Parents are looking out for their kids and other kids on the team. So we appreciate you as a parent and all the other coaches that are parents as well. And just as a reminder, what we're building out is a service that does not exist in amateur and recreational sports. So that's why these athletic trainers are really excited to help you as a coach, you as a parent, you as athletes, really understand how to manage an injury or just discomfort. If you're at home right now doing exercise and you realize, my shoulder doesn't feel right, but I don't want to go to a clinic because of the risk of getting the virus, that's what we're creating, is an opportunity for this level of expertise to be available to everyone. So the athletic trainers are in 8 different states right now. I'm looking at the board. WaveOn.care is how you can get in touch with them. We're super excited about what we're doing. So coaches, thanks so much. We're going to record this. We're going to kind of splice it up and send it out so you guys can have a follow-up if you want to send it to your parents. So from me personally, thanks so much for joining. Athletic trainers, if you have any last minute thoughts, if you want to thank the coaches and the listeners, let them know, and then we'll move forward. Do you guys have anything you want to say?
This is Beth. Can I just say something real quick?
No, please.
I'm a parent, and I have a sports moms community that I serve, and I am so encouraged by this call. It has been one of the best Zoom calls that I've gotten on, as far as information and just the level of passion I can tell just with the trainers and with the coaches and with everybody involved in this. I'm super excited and encouraged to share this with the sports moms. So just wanted to thank you all.
No, Beth, thank you. And definitely stay in touch with us. We're going to do more of these. We have one this same time next week, and it's organic. We don't have an agenda. We had a framework of what we were going to talk about, but we weren't following a script. We were off script. So you listening, join next week. Hopefully come in with questions. We'll pass it out. Hopefully there's more listeners, and we'll continue to pass this information. Dustin, you might have something you want to mention. Looks like you're going to say something.
No, it's the same thing. I was glad that Nora was able to bring me into this. I'm very informational, hearing from some other trainers on how you guys are taking care of your athletes, and kind of the same that I'm trying to do for my girls as well. Just very passionate about what we do, and care about these girls and athletes, and hopefully soon we'll get past all this and move forward.
Fantastic. Well, with that, guys, that's been 45 minutes. I thank everyone for joining. So WaveOn.care is where we find everybody. You guys know each other personally. Continue the communication, and let's go forward for the betterment of the health and wellness of all the athletes that we're here focused on. So have a good day, guys. Take care.
Thank you, you too.
Yeah.